Hey guys, Sam Chase and I can't wait to connect with you on our first ever Facebook Live where we get to know one another and take some of your questions on hot topics. So please don't forget to sign up at go.medschoolcoach.com/podcast. And we'll see you at 7 p.m. Eastern Standard Time on September 24th. See you there.
Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm excited to have my very first guest here since I've taken over as the host of the Prospective Doctor. We have Dr. Michael Harrell, who is an ophthalmology resident at the Boston Medical Center and Boston University. Michael and I have actually known each other for many years, and he's had an exciting journey. So I just want Michael to tell me a little bit about yourself.
Thanks, Arkita. It's also a pleasure for me to be here on your first episode of The Prospective Doctor. A little bit about myself. I am a native Texan. I was born in a small town north of Houston called Huntsville, Texas, and I pretty much grew up in Dallas. I went to the Science and Engineering Magnet High School in Dallas after going to some of the other non-magnet schools in the Oak Cliff area. I went on to Morehouse College for undergrad, got a degree in biology from there, and then via the early medical school selection program at Boston University School of Medicine, which Dr. DeRowan also did, and where we met, I was able to complete my MD from BUSM. From there, I went on to do an internship in general surgery at University of Massachusetts in Worcester, Massachusetts. While in medical school, I was able to obtain a scholarship from the United States Navy through the Health Profession Scholarship Program, became a commissioned officer in the Navy with plans to serve as a naval physician once I finished medical school. So I did that. After my internship, I went on to active duty in the Navy. I served for 4 years as a general medical officer, doing a variety of things, including a deployment to Europe. That was a really good experience, and if there are questions about that, I can also talk about that. After doing my repayment to the Navy, I knew that it was time to get back to training, so I left active duty and planned my next steps, which was always to do ophthalmology training. So I applied in the match for civilian ophthalmology positions, and I ended up matching back at Boston University, which is the place that made me. So I'm happy here in Boston again, learning and training with some of the best ophthalmologists and brightest minds in our field. I'm single, no kids. All my family's, for the most part, in Texas. My plan is to end up back in Texas at some point.
Awesome. It seems like you've had quite a journey going from Texas to serving in Europe and then right back to Boston. So it's kind of come back full circle. So it'll be very interesting if you end up in Texas after this.
I hope it's that interesting because I certainly want to. I've been away from home for a long time at this point, and I miss my family.
Can you tell me what made you choose ophthalmology?
I think in most medical school curricula, ophthalmology is one of those surgical subspecialties that isn't really discussed much outside of the neuroscience conversation about visual pathways and kind of the deep science. No one really gets much of an exposure to the field of ophthalmology unless they really know about it ahead of time and seek it out. So while I was in the early medical school selection program at BU, one of the summers I was assigned to a mentor. And my mentor, Dr. Edward Feinberg, who is a chair emeritus of our department at BMC, as well as retired vitreoretinal surgeon, he exposed me to ophthalmology as I know it today, really. And this was very early in my medical school career. So I just really fell in love with the disease processes. They're just so interesting to me. There's so much variety in the day. There's so much variety in the way that we can all practice. You take three ophthalmologists and ask them what they do and how their days look, you will get three different answers, which is really cool. When I get tired of being in clinic all day, seeing patients, I can run away to the operating room and have a day full of surgery. And generally, our surgical procedures are relatively short, not as long as other surgical specialties, but in a lot of ways, we get so much instant gratification. When you take out a cataract and give someone a new intraocular lens implant, and then they wake up from the anesthesia the next day, their vision's close to 2020 or 2020, there's no greater feeling than the patient just thanking you for changing the way or even restoring the way they interact with the world through their vision. So ophthalmology is awesome. The lifestyle is also great, which a lot of people may not talk about as much, but there isn't a lot of emergency. There isn't a lot of call as an ophthalmology attending for the most part. The pay is on the higher side. And I believe our profession has very high satisfaction ratings consistently.
That's amazing. It seems like it's such a gratifying experience to have that instant fix to patients' needs. And it's also quite wonderful that you were able to be exposed to such a great mentor such early on in your career.
Yeah, one patient I had, right now I'm doing a rotation that's 12 weeks long at Boston Children's Hospital. And this is where we get the majority of our pediatric ophthalmology experience. And mind you, Boston Children's Hospital is arguably one of the best children's hospitals in the world. So I'm learning from world leaders and experts, people who literally wrote the books and developed surgical techniques that people across the country and the world use. We had a patient after doing strabismus surgery. This was a young teenager who had double vision for most of his life. We did eye muscle surgery and he woke up in the PACU and we were checking his vision and checking his alignment because we did an adjustable procedure where we could actually do more adjustments on his eye muscles in the PACU if he wasn't as aligned as we wanted him to be. And he was so overjoyed that this was the first time that he could remember that he wasn't seeing double. I almost cried. Like, this is why we do this. Like, it was the perfect example of so many days that you can have in ophthalmology, just really restoring or improving the way that people interact with the world that a lot of us may take for granted on a day-to-day basis.
Ophthalmology is a pretty competitive specialty. How would you suggest that a student apply themselves on rotations if they had an interest in ophthalmology?
Are we talking about ophthalmology electives or are we talking about other clerkships?
I think the entire experience through the medical school curriculum.
Cool, I can answer both of those. Yeah. So I would say if you know early on that you want to pursue ophthalmology, be sure to strategically plan your electives and rotations during your medical school curriculum to include as much ophthalmology as you can. Outside of traditional clinical rotations in ophthalmology, I even found a rotation that was a quality improvement elective, and I found an ophthalmology attending to do a QI project with.
Wow.
So I had clinical electives in ophthalmology. I did away rotations in ophthalmology through the military. And then I also had this QI elective that I turned into an ophthalmology elective. So that's one way, be strategic and persistent. And then another way is to find ways to create experiences to learn more about ophthalmology during other rotations. I did neonatal intensive care sub-internship when I was in medical school. And during that, we had to do a presentation, and I chose retinopathy of prematurity to do my presentation on. So that was a way that I satisfied the requirements of the rotation, yet I still took the opportunity to further enhance my knowledge of ophthalmology, even while doing something that was non-ophthalmology. And people may ask, why did you do a NICU sub-I? And I did the NICU sub-I because I really like babies. So that seemed to be the coolest option for me.
That sounds like great advice. And it kind of moves me into my next question because it hit on that. But I want us to think outside of ophthalmology and just as medical students in general. You're on the admissions committee for BUSM, and you're also involved in residency interviews and interviews for a pathway program where you matriculate from college to med school directly. What things stand out for you as a great candidate?
Oh man, there's so many things in an application package that stand out, and so many things that fade into the background, if you will. One really amazing thing that can stand out, that can really push you over the top, is letters of recommendation. It's not good enough to have the requisite number of recommendation letters. You need to have recommendation letters that are glowing. It's also not good enough to have recommendation letters that are full of fluff. You need to have recommendation letters that are glowing and substantive and written by people who can prove through the letter that they got to know you. If you can have someone who is respected, spent a good amount of time with you doing clinical work or research or community service, and they can say, in maybe not even these exact words, but they can convey, I would love for this person to be my colleague one day. Or if I had a problem with my eyes, I would love for this person to take care of my eyes or to take care of my kids' eyes. That speaks volumes to me. Another part of the application that stands out to me is things that you did outside of traditional medical school work. If you were able to excel as a medical student and commit your time and energy to community service or servant leadership experiences that were meaningful to you, and that is really important, meaningful to you, then that tells me that you're going to do more with your life than just be a resident, just be a medical student, just be a practicing physician. There are so many more pulls on all of our lives, all of our time. There isn't much time in your professional career where you're going to just be a doctor. People are going to expect you to take an active role in the leadership of your department, or to mentor students, or to do research, or to run a research program, or to take a leadership position in your professional society or professional organization. You may be called on to be a leader in your church or in your community. So there's never going to really be the time when you can just learn how to juggle all of these things. So you need to start practicing that early. And why not practice that as a medical student? You have much more protected time at that point.
Absolutely. And I loved what you said about making sure that it's something that's meaningful to you. A lot of people look into different organizations, whether or not they're student interest groups or volunteering in a nursing home if you want to be a geriatrician or something like that. But it's okay to want to dance or to host a podcast or to do something outside of medicine. As long as you're passionate and you can explain why you want to take leadership in that, it's okay.
And that is the key. Being able to explain to other people in a way that lets them know that you are actually passionate about it. That makes me think about people who do research for the sake of doing research. Yes, you have 10 publications. Yeah, that's awesome. That means you did a lot of work to make that happen. But if when you're talking to me about the research that you've done or the paper that you're the second, third, fourth, 10th author on, and your eyes don't light up and you're not glowing while you're describing this, then that makes me think that you did this just for the sake of this application and not because you're really interested in it.
I always say one good extracurricular is better than 10 meaningless.
I agree.
And on that topic, what types of things would you advise that a student avoid?
So they should avoid lying.
That happens?
That is one of the biggest things you should avoid. Don't make things up because you never know who you're going to be talking to in an interview. Someone's little brother or someone's cousin, someone's spouse may know people who did this or may be a part of this organization or group, and they may call you out on it and you don't have the right answers. That's going to tank that interview very quickly. So be honest, be upfront. Don't gloss over things that are less than favorable in your application. If there's something that is not good, something that you think is going to detract from people wanting you, then I would address it up front, describe the circumstances, how it happened, why it happened, and then what you learned from it, how you've grown and changed after having said experience. And that lets people know that you are mature or at least have matured since that thing happened to you, that you know how to recover from adversity because adversity will come, believe me. And these are like very mature and adult lessons to learn. And it's awesome if you've already had to experience them and learn from them. Other things to avoid are doing things that I mentioned a minute ago, doing things just for the sake of doing them, having fillers and fluff.
Those sound like good things. And I think
those are enough.
Those are things that are very prominent. Like if you write something on your application, make sure that it's correct and true and that you can also regurgitate what you've written. If you have a blemish, you're going to expect to be asked about that blemish and you should have a valid explanation. Like you said, adversity will come to everyone. We're human beings. People make mistakes. People have things happen to them. Life happens. So it's not going to put you out of the game if you have a blemish, but be able to explain it.
Well, I guess another thing to avoid being unprepared. Because if you don't plan to succeed, then you won't. You will fail.
Speaking of a different time and applications and things like that, we're living in 2020, the land of COVID. I would suspect that applications are being evaluated differently because of the times that we're in with the virtual learning and the lack of being able to fly in person to interviews. Do you know if students who were unable to get shadowing or volunteering hours during COVID or take certain courses that they had planned to take or away rotations will be evaluated differently in this run? And I understand if you don't yet because the season is fresh.
Yeah, I think, like you said, these are uncharted waters. This experience is new for everybody involved. It's not just new for the applicants, it's new for the interviewers too. It's new for the admissions departments, the residency programs. It's new for everyone. So we're all having to rethink the way that we traditionally evaluate or assess applicants. But at the same time, applicants also need to show some ingenuity and creativity to try to get some of the things that they planned or wanted to do accomplished in different ways. I heard an idea yesterday while I was on a Zoom webinar about how to be a successful applicant for ophthalmology residency. And this idea, it kind of stuck with me because it was quite innovative and it was a really good idea. So this was a senior attending ophthalmologist saying he did a virtual research project with a student that took them probably a few weeks. So there are ways to get substantive research, ways to get substantive and meaningful shadowing experience in the specialties that you're interested in or in other specialties, really. There are projects that still need to be done that don't require being in person. Phone calls, Zoom meetings, participating in telehealth visits with the attendings. These are all ways to get FaceTime and to really develop the relationship with attendings outside of the traditional clinic setting. So, yes, I believe applications are going to be evaluated differently. How that's going to really look is kind of yet to be decided, and it's probably going to look differently for every individual interviewer. But all is not lost. There are so many other ways to skin this cat, but it's going to take some creativity. And it's also a reminder that all the applicants are in the same boat.
Absolutely. We're all in this together. It's a process and we're learning from it and we're adjusting to it. So I think that that's great to point out. Like, you're not the only one who has to go through this process this year.
There are so many changes coming down the pike that are going to really rock this interviewing and application process. Specifically, step one is going to pass fail. And, there's this question of whether step two is going to be weighted more heavily in the future. No one knows. And these 3-digit numbers make up generally a very small part of the application as a whole. So I would focus much more on trying to be the most well-rounded applicant that you can be. Talk to mentors, talk to advisors, talk to other applicants, and figure out what other people are doing. Pull together some really good ideas and then strengthen your application however you can.
Absolutely. I think that that's excellent advice. What would you have to say to a student who is applying to medical school or residency who may not get an acceptance on their first try?
I would say if you get knocked down, you have a couple of options. You have probably 3 options, I would say. One of those options is to stay down. I think that's the least desirable option. The second option is to get up and walk in a different direction. And some people may need to do that. Some people may choose to do that. This may not be for you. And that may be a hard pill to swallow, and it may take a lot of mature self-reflection, but this isn't for everybody. And there may be some conversations that people need to have with themselves to figure out, why was I not successful? Maybe some of this is on me. Maybe something I need to do different. And then the third one is to get back up and run back towards that goal that you were approaching. I've been knocked down before. I laid there for a few minutes. I cried and licked my wounds. And then I got up and called some of my mentors and said, hey, I think you've been through this before. What should I do? What are my steps? Who should I be calling? Who should I be emailing? What do I need to do to get back on track? And then I got back on track. And then later, I fell again. Did the same thing, got back on track. And then I made it to where I wanted to be. So it's going to happen unless you are the luckiest, most prepared person in the world. You are going to experience some setback, whether it's small or large, catastrophic or minuscule, immaterial. You're going to experience a setback, and you got to really figure out what you want to do and how you want to recover from that. The most successful of us are the ones who recover quickly.
I love how you broke that down into the 3 avenues that you have to make a logical choice and decide to go forward with. And the other thing that I love, as you and I and our friend circle have kind of coined using our mentors, like using our resources. We call it our personal board of directors, where you have people that you trust that are in it for your best interest. So you should realize when you fall down, you shouldn't suffer in silence. So talk to your friends, talk to people you know in your class who've gone through similar things. Talk to your family. If you have family that doesn't understand medicine, there is someone who does. Or even talk to us here on this show. I think in the future we may allow for some question and answer sessions or listener letters or something. But if we don't know the answer or your friends don't know the answer, someone will find someone who does, because no one has ever experienced things alone. I think that's great advice.
I would also say that it's probably understated how much good advice you can gain from someone who's outside of medicine. People who are outside of this world that you're in may have a fresh take, be able to give you this wonderfully simplistic perspective that you never even thought about this, super complex, convoluted problem with multiple layers. And they'll just drill down to the center of it and say, well, why don't you do this? Or why didn't you prepare this way?
Absolutely.
And that simple approach can be life-changing for you.
Yes.
So don't be afraid to call and talk to your mom who may not be in medicine and have her give you one of those, pep talks from your childhood. It's okay.
That is all right. And those people should be on your personal board. I know I talk to my mom multiple times a day, and she's not in medicine, but she gives very great advice. So I would definitely use your resources.
Absolutely.
Another thing, as we talked a lot about activities earlier, you're quite involved in the Student National Medical Association and the National Medical Association. Can you tell us about that journey and how it's impacted you as a physician?
Sure. So, for those who don't know, the National Medical Association was established in a time when Black physicians were not allowed membership to the American Medical Association in 1895. Over the time, the National Medical Association saw fit to create a subset of itself that was specifically devoted to medical students who were Black as well. The American Medical Association had a similar organization, or has a similar organization, called the American Medical Student Association. So the NMA created the Student National Medical Association. In 1964, the SNMA decided to become its own organization and then separated from the National Medical Association. So these are national nonprofit organizations that are devoted to supporting, recruiting, maintaining underrepresented individuals in medicine. So when I went to BUSM for medical school, I discovered the SNMA. I'd never heard of MAPS before while I was in undergrad. MAPS is the undergraduate arm of the Student National Medical Association. It's the minority association for pre-medical students. I didn't know about MAPS. So I learned about the SNMA through my interactions with other Black medical students at BUSM. I learned about the things that they did in the community, going to local churches and doing health fairs and linking up with other Black medical students in the New England region and having conferences and supporting each other and really being a family in the medical school. And I just knew that that was something that I needed to be a part of. So I, of course, being me, jumped in it head first. The first year of medical school, I became one of the co-presidents of the chapter. Second year, I was a co-president as well. I went to the SNMA's national conference, which happens in a different city every year. And this is the largest, most wonderful celebration of Black medical students in the country. It is awesome. I drank the Kool-Aid, and I knew that I needed to be a voice. I needed to have a role in the leadership of this national organization one day. So I came back to school after that first conference I went to in Chicago. And I gathered my personal board of directors, Arkita being one of them. And, it was an awesome thing because you and Carrie Claudia were both national leaders in the SNMA at that point. Kara Lee was the associate regional director at that point. So I talked to all three of you about what I needed to do to get to where I thought I wanted to be in SNMA leadership over my years in medical school. And then Brittany and I, my Spelman sister, we sat down and we charted a plan for how I was going to strategically get to the role that I wanted. And I thought at that point I wanted to be national vice president by the time I was a fourth year. That changed. But we decided which jobs I wanted to do each year that would help me get the requisite knowledge and experience that I needed to become the national vice president by the time I was a fourth year. So over those years, that turned into me being a regional director, me being on the National Internal Affairs Committee, me being one of the co-chairs of the Internal Affairs Committee, me being the national parliamentarian. And I loved the SNMA so much. I loved the leadership of the SNMA so much that once I graduated from medical school, I didn't leave the SNMA. I was already a life member of the SNMA. I decided to stick around and join the Strategic Planning Council for the SNMA and did a 3-year stint on the SPC. And I was the Chief Planning Council member my third year. But being a part of this organization really opened my eyes to some really cool opportunities and things about myself that I didn't know. Like, I love organizational governance. I love strategic planning. I love running nonprofits. Like, that was cool. I love corporate development and fundraising. I love being on a board of directors or a board of trustees. All of these things I would have never learned if I hadn't jumped into the SNMA and taken the time and energy to do something outside of just medical school. So that blossomed into me deciding to step into the National Medical Association as well. At this point, I'm less involved in the leadership of the SNMA. I still mentor in the SNMA. I'm actually participating in an SNMA webinar panel discussion next week about how to get into ophthalmology. But that led me to finding something that I cared about within the NMA, jumping into that. And now I'm the postgraduate trustee on the board of trustees. I'm the postgraduate section chairperson. So our section is the place, the home for the young physician in the NMA. The postgraduate section is for residents, fellows, and attendings who are within the first 5 years of their practice. We do networking events, we do webinars, we do partnerships with other organizations that can specifically help and support and train and mentor young doctors. So I'm in my second year of my 2-year term. It's been awesome to be on this national board of trustees, running this national organization that does advocacy and lobbying and writes policy statements and national media press and national convention planning and all kinds of things, international mission trips. We do so much and represent the voices of thousands of Black physicians in the country. And, without my very early exposure to the SNMA, I wouldn't be here doing this work. So I recommend that even if you don't join an organization like the SNMA or the NMA, you find something that you're passionate about, something that's going to help keep you rooted, grounded, and devote some of your time and energy to it, because it is only going to make you a better person, a better friend, a better family member, a better physician, a better advocate for your patients.
I think that no one else could have described the National Medical Association and the Student National Medical Association better than you did right there. And you ended it with quite a pearl. So I am so appreciative of you sharing your knowledge with all of our pre-med and medical students. It's been a joy to hear about your journey from starting out in Texas to going to the Navy to going back to cold Boston to learn a lot in ophthalmology and to see just how much you're dedicated to serving the community as well. Because like you mentioned earlier, it's one thing to be a doctor, but you can utilize those skills in all aspects of life and give back to others.
Indeed.
So on that note, I think we will end here. And I just want to thank you so much for being my very first guest. And I guess you could say goodbye to the guys.
Well, I just want to say you're welcome. And I appreciate you for allowing me to share my story and to hopefully be some level of inspiration or motivation to anybody out there who thinks they can't do it. Yes, ophthalmology is very difficult to get into. However, it can be done. All you need is one person to say yes, one program to match you. That's really all you need. Don't take no for an answer. Don't give up. Just be prepared. I'm out there. I'm on Facebook. I'm on Instagram. I'm around. If anybody has questions, thoughts, needs to be paired with a mentor maybe, or, whatever anybody needs, I am so available to help. I'm busy. I'm exhausted. I'm a resident, but I will find the time to help anybody who needs my help. Thank you for allowing me to use your platform as well to get this message out.
We will link Dr. Harrell's information in our show notes when the show posts, so you'll be able to see if you want to reach out to him.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.